I'm Dr. Keith C. Ferdinand, a cardiologist at Tulane University School of Medicine in New Orleans, Louisiana. We're going to be speaking with Chad, a young man who has suffered some of the consequences of FH. His story is really enlightening, especially for those Black Americans who have conditions that often aren't screened and diagnosed early enough, and for those men who have conditions and once even being diagnosed, won't take the medicines or the appropriate treatment. We're going to be talking to Chad, and I think his story will be very illuminating. Chad, you're feeling pretty good right now. Early on, when you were young, I think you were only 27, you started having chest pain. What did that feel like?
I was in college at the time, finished up on my degree. After classes, I noticed when I was walking to class, I started getting short-winded, and I started having chest in like my flank area, my rib cage. And I had just lost my dad a couple of months ago, so I was thinking maybe it was just anxiety, stress from school, the loss of my dad. So I kind of just, was just putting it away. Actually, some days my wife would have to pick me up from my class and drive me to my car because I just could not walk. And like I said, I put it off until that morning I woke up and I just felt like my heart was going to rupture. And, I went into the ER, God blessingly.
That's one of the problems we see with familial hypercholesterolemia, or FH. It's a genetic condition, and you can be a fit young person and have a heart attack or stroke with this condition. So I would think that most people who are around you, if you told them you were having chest pain, didn't think that you actually were having heart pains. Is that correct?
Yeah, that's correct. Like I said, they thought I was just having anxiety attacks or acid reflux, heartburn. It was just nobody ever questioned I was having heart issues or anything like that.
Now, I'm in New Orleans and you're in Baton Rouge. We're really only 90 miles away from each other. And the Southern cuisine, the Southern cooking, it tastes good. A lot of saturated fat, animal fats, fried foods. Your diet probably wasn't as best as it was, but what do you think now? You're eating better. If you didn't take medicines, your cholesterol probably would still be high.
Yeah, it would. I'm actually married to a dietitian. My wife is a registered dietitian. So as far as like getting my proteins and vegetables, I have no choice. We live together. So it's like I eat what's in the house, whatever she says goes. And, I'm very grateful that some people don't have that resource and, they kind of just have to fend for themselves. But just eating right wouldn't be enough for my genetic disease. It's a combination of being prescribed the right medications, exercise and diet. And even that's just not enough sometimes. So, you have to be very proactive in monitoring and, making sure that your cholesterol is being, controlled.
I think, Chad, you make a wonderful point. That is, for most people, it's really important to eat a diet that's low in saturated fat or animal fats, more fruits, vegetables, exercise, maintain good body weight, avoid smoking, take blood pressure medicines if needed. But in your particular case with FH, familial hypercholesterolemia, it's a genetic condition. And you should do the right thing. You should control all of those risk factors. But without the other medications, you still would be having very high cholesterol. Would you agree?
Yes, I agree. My numbers would still be very abnormal.
Now, some people are afraid. They go on the internet. I hesitate to call it information. They read stuff on the internet about how bad medicines are, the statins. Why do you feel you can take medicines and other people are afraid to take medicines? How did you get over that hurdle?
Like being in that hospital, seeing my son, not knowing if I was going to make it out, I'm basically fighting for my life. So, it's every day I look at it, it's like, I'm going to do whatever I have to do, take what medications I need to take to make sure, I extend my life. I want to go the long way, take it all away,
Now, one of the problems we see, especially in the Black community, a lot of people don't seek care, especially Black men.
Mm-hmm.
What would you recommend in terms of your other colleagues, young Black men like yourself, who haven't been to the doctor, haven't gotten their blood pressure checked, never got a blood draw for cholesterol? What was your recommendation?
I would recommend, go out and get it checked. I come from a family of, I have 5 siblings, 5 boys, 1 girl. And within my family, I've lost my dad to a heart attack. My mom has had bypass surgery. I have had bypass surgery. And two of my brothers are also had quadruple bypass surgery. And I mean, we all fit the bill of healthy people, living a good lifestyle, doing the right things. And, I mean, we almost lost our lives to this disease. So I would tell anyone, just go and get your cholesterol checked. Be a big ease off yourself, just knowing where your numbers are and where you stand as, a health aspect.
Chad, that's really important. At one time, we thought that FH, familial hypercholesterolemia, was a rare condition. We now know it may be common in as many as 1 out of 200 to 1 out of 250 people. So you were at Southern University, one of the largest universities in the United States, perhaps the largest Black university. Those thousands of persons you were walking past in class and at the football stadium, many of them may have FH and not know it. If it's 1 out of 200 or 1 out of 250, certainly there are lots of persons you went to school with and you sat down at football games with who had FH and didn't know it. I think your recommendation is spot on. The only way you're going to know is to get your cholesterol checked.
I agree. And usually when I'm talking about FH, to kind of give an example of the 1 in 250, I use that example of being in a football stadium. You might have 50 to 100,000 people in the stadium. You do the math, then you might have 300 or 400 people that's living with FH that don't even know they have the disease, just within that stadium.
One of the important things that I think you're showing us, Chad, that you can control this disease by taking appropriate medicine along with healthy lifestyle. And we're certainly not making the case that the Southern cuisine, the fried foods, the high intake of animal fats, not controlling your blood pressure, having diabetes, we're not saying those are not important, because they are. For most people who have heart disease, those are very important factors. But in your particular case, it appears to be genetics.
Yeah, it's genetics. Like I said, when I 2004, when I initially had my quadruple bypass surgery, I was just given a statin. I took my medications as prescribed, and it went on for 8 years. I did what the doctors told me to do, and then 8 years later, I found myself back in the emergency room, and found out that 3 of the 4 blockages basically have failed. I was back to the drawing board.
That's interesting, because one of the things I see in many patients, not necessarily you, because you're very dedicated, is that the cholesterol will come down. They'll think the ball game's over. They're ready to blow the whistle and say it's all finished. And some of them will really stop their medicines and not adhere a long time. Why do you stay on your medicines? What motivates you?
Like I said, just going through the whole process of, the surgeries, the rehab. I don't want to be in that position anymore. I don't want to put my family in that position anymore. So, for me, like I said, is I take my medications. I'm dedicated. I advocate for myself. You just want to live, and just prolonging your lifestyle.
So here we have a condition. We have treatments, high intensity statins, the PCSK9 inhibitors. There are other treatments that are coming down the pike. It's important to take medicines and continue taking medicines. And what I'm hearing from you is, once you've been through the type of terrible situation you've lived through, that's an easy call.
Yeah, it's very easy. Like I said, it was a long, hard process for myself and my family, and it's just something that I don't want to, I don't want to put myself back into, especially if I can avoid it.
Sometimes in medicine, we have big words for everything, and I've used the term familial hypercholesterolemia, but really it's just FH. Where do you get information, and where do you suggest other people get information on FH?
I would suggest everybody go to the look up the Family Heart Foundation. You can Google them. You can go to their website, Facebook, any social media platform, and you will find they have a list of resources there about FH. How to identify it, resources to help treat it. They suggest see your doctor, get your cholesterol checked.
So you're dedicated, I think, to continue medicines. Give me a recommendation that you give to other guys, regular guys, who are out there living the good life, eating the boudin, the gumbo, the fried shrimp, just having a good life. They feel okay.
Yeah.
What's your recommendation?
First of all, for the food, have it in moderation. We can't have it every day. It's okay to, indulge yourself every once in a while, but let it go every day. And as far as the medications go, if, you go to the doctor, your cholesterol is high, they prescribe you medications and say you need to take this, just take it, man. It's like I said, it's not painful. It'll be worth it in the long run. You want to see your family, you want to see your children grow, your grandkids. It's just something you have to do to prolong your life.
Let's talk a little bit about prevention versus waiting till you need bypass or you have that heart attack or stroke. How important is prevention?
I think prevention is very important. Before I was 27 in the emergency room, I had never had my cholesterol checked. Even knowing that my daddy was going through, he had quadruple bypass at the age of 32. I just never figured it would be something hereditary. I think if I would have been monitoring my cholesterol at an early age, that would have been a very good way for me, preventing myself from having quadruple bypass at the age of 27. Now that my wife and I know that I'm diagnosed with FH, I have a son and a daughter, 11 and 6, and we get their cholesterol checks once a year now, just, monitor their cholesterol and, being proactive, staying on top of it.
FH, which is familial hypercholesterolemia, is a genetic disease. It's more than it runs in the family. Would you suggest also that if a family has FH, that even the children get checked?
I would recommend, I think the doctors recommend you can get your kids tested after the age of 2. Like I said, my daughter is 6, my son is 11, and, we get them tested once a year just to monitor their cholesterol levels.
So we know that there's the bad cholesterol, the LDL cholesterol, and many people say it should be less than 100. But once you've had a heart attack, stroke, bypass, angioplasty, you have disease, you're very high risk. And in that particular case, that LDL should be as low as you can tolerate. And in most patients, the recommendation is get that LDL less than 55. In your particular case, Chad, statins weren't enough. You took other medicines to lower your LDL. What else did you do?
My doctors put me on a combination of medications. I was prescribed a statin, an exetamine, and a PCSK9 inhibitor. And like I said, a combination of those medications, they dropped my LDLs from above 200 till now. I think my total was below 70. And, my goal and the doctor's goals are, just to keep chipping away at that number to get it as low as possible. Like you said, when I initially had the bypass surgery, I was given a statin and, I took it every day, but it was just not enough. And, when I found myself back in the emergency room in 2012 and, the blockages had failed, the bypasses basically had failed. And we decided to go up to Johns Hopkins. That's when we were introduced to the different medications that were available to treat cholesterol medications. One of them that we were introduced to was the PCSK9 inhibitor, something that wasn't available when I first, back in 2005, when I had the bypass surgery, that was available now. And that made a world of a difference in, my cholesterol numbers moving forward.
Chad, your story is a wonderful story because it teaches us so many things. And one of them is medicine is always evolving. We are simple human beings, but we're learning a lot. And we know that statins are the bedrock to lower LDL cholesterol, but especially for very high-risk people like yourself who have FH, who've already had some blockages in their heart or have had a heart attack or stroke, that statins alone is not enough. And I'm so pleased that you were able to get the PCSK9 inhibitors. There are other medicines that are coming down the pike. There's one called inclisiran that you inject twice a year. But we know that with these medicines, they won't work if people don't take them. So what's your recommendation, especially for those young Black men who say, yeah, I heard you, but I'm not taking medicines?
I just want to say, listen to your doctors, take your medications.
Thank you so much, Chad. I think your story illustrates so much. And one of the most important take-home messages is get tested, know your cholesterol. If you have FH, that genetic condition, get treatment, but not only get treatment, but get the right treatment and stay on that treatment. So Chad, it was so good talking to you. You have a lot of information. What do you recommend to other young men, especially other young African-American men like yourself, who want to get more information?
If you're looking for more information, I strongly suggest that you visit the Family Heart Foundation. You can look them up on social media, the internet, and there you will find a list of resources.
Thank you so much for your information. I think others are going to benefit from you telling your story.
Thank you, Dr. Ferdinand, for having me.